Cardiology is a fascinating field of medicine that focuses on the study, diagnosis, and treatment of diseases related to the heart and blood vessels. Among the various cardiac conditions, stroke remains one of the leading causes of death and disability worldwide. As future medical professionals, it is crucial to develop a comprehensive understanding of ischemic and hemorrhagic stroke, as well as their pathophysiology, management, risk factors, and implications. Ischemic stroke is the most common type, occurring when a blood vessel supplying the brain becomes blocked. Embolic and thrombotic mechanisms cause it. Management involves time-sensitive approaches like thrombolytic therapy and mechanical thrombectomy to restore blood flow and save brain tissue. Hemorrhagic stroke is a less common but more dangerous type of stroke caused by bleeding into the brain. There are two main types: intracerebral hemorrhage, ICH, and subarachnoid hemorrhage, SAH. ICH is often due to high blood pressure, aneurysms, or anticoagulant use, while SA is usually from aneurysm or arteriovenous malformation rupture. Treatment involves managing hypertension, controlling pressure, and providing support for ICH, while SA can require surgical intervention. Transient ischemic attack, TIA, refers to a transient episode of neurological dysfunction caused by a temporary disruption of blood flow to the brain. Although the symptoms resolve within 24 hours, TIAs should not be underestimated, as they are associated with an increased risk of subsequent stroke. The diagnosis of TIA necessitates a meticulous evaluation of the patient's history, physical examination, and neuroimaging studies. It is crucial to identify the underlying etiology of the TIA, as this guides further management and stroke prevention strategies. Understanding stroke risk factors is crucial for prevention. Non-modifiable factors include age, gender, ethnicity, and family history. Modifiable factors like hypertension, diabetes, obesity, smoking, and alcohol consumption can be addressed with lifestyle changes for reducing stroke risk. A thorough stroke assessment and neurological examination are crucial for diagnosing and evaluating stroke patients. It involves obtaining a detailed history, conducting a physical examination, and assessing neurologic deficits across multiple domains. Special attention is given to the NICE, which standardizes the severity of stroke and aids in treatment decisions. Accurately assessing neurologic deficits helps determine the type of stroke, localize the affected area, and guide management decisions. Imaging techniques such as CT scan, MRI, and angiography help diagnose and assess strokes. CT scans are fast and sensitive for hemorrhagic strokes, while MRI is useful for visualizing ischemic strokes at different stages. Angiography provides information about vessel occlusions and helps guide treatment decisions. Summary: the management of acute ischemic stroke involves timely reperfusion therapies like thrombolytic therapy and endovascular procedures. Thrombolytic therapy, using RTPA, dissolves clots, while endovascular procedures physically remove or disrupt clots. Strict eligibility criteria and time window must be followed. In summary, after a stroke or TIA, secondary prevention strategies involve lifestyle modifications and medication management. Lifestyle changes include a healthy diet, exercise, quitting smoking, and limiting alcohol. Medications like antiplatelet agents or anticoagulants are chosen based on the cause of the stroke and patient factors. Both carotid endarterectomy and carotid artery stenting are effective invasive interventions for stroke prevention. Carotid endarterectomy involves surgical removal of plaque from the carotid artery, while carotid artery stenting uses a stent to restore blood flow. Stroke rehabilitation plays a crucial role in achieving functional recovery and improving the quality of life for stroke survivors. It requires a multidisciplinary team approach involving physiotherapists, occupational therapists, speech and language therapists, psychologists, and social workers. Rehabilitation goals vary depending on the patient's deficits, but they generally focus on regaining mobility, improving motor function, enhancing speech and swallowing abilities, and addressing cognitive and emotional impairments. The rehabilitation process is tailored to each patient's specific needs and abilities, starting as early as possible and continuing throughout the recovery period. Distinguishing between true strokes and stroke mimics is essential, as the management and prognosis greatly differ. Stroke mimics are conditions that present with similar clinical manifestations but are not caused by cerebrovascular events. Stroke mimics can include migraine with aura, seizures, metabolic disorders, infections, brain tumors, and functional deficits. Detailed history taking, physical examination, and appropriate imaging studies are vital in differentiating between true strokes and stroke mimics. Clinical clues, such as abrupt onset, rapid symptom resolution, and associated symptoms, can help guide the diagnosis. Despite optimal management, stroke can lead to various complications that require close monitoring and targeted interventions. Cerebral edema and intracranial hypertension can occur following a stroke, leading to increased intracranial pressure and subsequent brain damage. Interventions aimed at reducing cerebral edema include osmotic diuretics, such as mannitol or hypertonic saline, and maintaining adequate cerebral perfusion pressure. Seizures are another common complication of stroke, particularly in the acute phase. Prophylactic antiepileptic drugs may be considered in high-risk patients. In the event of a seizure, prompt administration of antiepileptic medications, such as benzodiazepines or anticonvulsants, is essential to prevent further brain injury. Understanding its pathophysiology, advancements in care have improved outcomes to provide optimal care.